The CDC now says that pregnant women are 5 times more likely to be hospitalized if they're infected with COVID-19 than non-pregnant women. In fact, according to the Centers for Disease Control and Prevention, since the pandemic started in January, more than 9,900 pregnant women have caught the virus here in the United States. Nearly 3,000 have been hospitalized. 26 have died. Dr. Marsha Lachaud is an OBGYN with Memorial Hospital joining us via Zoom this morning. Good morning. Thanks for being with us.
Thanks for having me.
So I remember when you joined us at the start of the pandemic, I feel like now we've learned more about the impact of this virus on pregnant women, given that more studies have been conducted. So why are pregnant women at a higher risk of being hospitalized?
Because your immune system is compromised in order to accommodate the pregnancy. So because you don't have that strong immune system, when you do get sick, you tend to get sicker than someone who's not.
And is this at any stage of the pregnancy, early stages, even late stages, that you see that pregnant women are at a higher risk?
Any stage of the pregnancy, yeah.
So if a mother is infected, will she pass it to her fetus?
Well, the chances of we call vertical transmission, meaning the mother transmitting the virus to the baby in utero, is very, very low. But mothers usually that are positive for COVID-19 usually transmit the virus to the fetus by breathing on the baby and, just having contact with that baby the first few hours of life.
Right. So after the birth, and of course you want to hold and kiss and cuddle your baby. What mother would not? So if a fetus then is, infected with COVID-19, do they typically get really sick?
Yeah, so the babies tend to get really, really sick. Infants under, the age of 12 months actually get sicker than children because they don't have that immune system to help fight the virus.
And this may then also fall into the same category, which I just asked you. Can mom pass the virus through breast milk itself, or is it just that close contact that she can pass it on to baby?
Breast milk, it does not look like breast milk is transmits the virus. It's usually through that close contact.
So I'd like to know. I'm sorry, go ahead.
I was going to say, so if moms are positive for COVID-19 during delivery, they tend to either separate after the baby's born, separate the mom and the baby, or if they're not able to do that for whatever reason, mom is wearing a mask at all times when in contact with the baby and practicing frequent hand washing.
What kinds of questions or concerns are you hearing specifically from your patients?
Well, most of my patients want to know, what measures they can take to be safe. At our practice at Memorial Women's Health, we tend to recommend that pregnant women quarantine themselves after 37 weeks or 3 weeks before their delivery to help lower the chances of actually getting the virus at the time of birth.
And given that we are now seeing more younger people between that age of like 24 and 34 as an example, who are being infected, what is your message then to members of the community who make an assumption that, well, if I'm not around my elderly parents, I don't have to worry if I am positive and asymptomatic. I don't have to worry about giving it to anyone who will get really, really sick?
I will say that you are not immune. Just because we're younger, there are a lot of younger, patients that have really, really bad symptoms. So really, it's important to practice all the precautions, wear a mask in public, avoid large crowds, and then, washing your hands frequently and avoid touching your face.
And that those younger people who may have a friend who is pregnant could get just as sick, if not sicker, as those who are older.
Absolutely.
Dr. Lachaud from Memorial Hospital, thank you for your time this morning. Appreciate it.
Thank you for having me.